and that there was a lot of information or misinformation out there. COVID was a test, talk about a worldwide test of all of our healthcare systems and our knowledge around healthcare. You even alluded to earlier, a lot of people are like, do you maybe self-diagnose themselves? And like, you know what? I feel I can do this, I'll do that. And then not listening to a physician who has a lot of experience and they're kind of diagnosing on their own. You wrote this book on dead wrong. What motivated you to write this book, and what are you hoping that people will get out of it as they read through it?
Thanks, Grant. So look, the inspiration for the book was really the way I felt when COVID happened. I was actually sitting here in my home office, and I remember it feeling like a deja vu moment from the HIV/AIDS epidemic. And the book actually starts out in chapter 1 with my patient, Jerome, who dies from AIDS. And it was a very similar public health crisis in that myth and disinformation was taking over the narrative. And I talk about Jerome to his dying day insisting that he was not a homosexual, could not possibly have AIDS, and I was clearly wrong as his physician. And we saw the same thing with COVID, right? The stakes being just as high with regards to infection control, with regards to morbidity and mortality. And I felt it was the time to tell this story because in healthcare, as healthcare leaders, as clinicians, we've always accepted that people got the facts wrong. We've always accepted that myth and disinformation was just part of the wallpaper at the hospital. It was just something in the background. We didn't really pay attention to it. But what's happened in the era of technology that we're in is that myth and disinformation is actually getting worse because of technology, right? And because of the consumer-centric world that we have, and because we have devices on every wrist, every finger, everything we can carry is carrying information in a way that we didn't have in the past. So while myth and disinformation may have been around since the Black Plague, it's now actually getting harder to get the facts and the truth out there. And we've lost a lot of trust in science, particularly since COVID. So the book is really a call to action to healthcare leaders to say, no one is coming to save us and no one is coming to save our patients.